Well, without Jen, I'd be a nervous wreck.
My name is Jen, and I am an LPN at Exodus Place. The medical department, when I first started, was very chaotic. There was a lot of ins and outs, the intakes and people leaving. The meds were a mess. There wasn't any rhyme or reason why we had the people's meds still. If they were coming back to get them, if they left without, they're just never going to take them again. So it was very chaotic.
My name is Whitney, and I'm the medical case manager at Exodus Place. The medical department was just passing meds. There wasn't a lot more to it. If guys needed help, things like that, of course they would address that, but it was not what it is today. Making sure that the guys were med compliant, taking the medications that were prescribed to them, and like transportation for guys needing somebody to go sit with them at doctor's appointments, things like that. We didn't have staff that could do that. It's transformed completely 180.
Right now, the medical department, every med is accounted for. The people are here, I have their orders for what they need. Whitney's been a great help in getting appointments scheduled for them. Our ambulance calls have been down. Everything has come together. The biggest challenge I think the members were facing was consistency in the medical department. Pat had been here part-time through the whole COVID thing, which was a blessing to this place. She's still with us, so they still see her face 2 times a week, but they still see mine every day. And so I think the consistency of seeing one person, that person knowing their meds well, able to discuss their medical issues with them because I'm familiar with them, it makes me feel like I've accomplished something.
I think what's important is like when these guys go out to the hospital, we're catching them on their way back more. Now we're catching them for a full circle care. A doctor has now told you that you need these scheduled appointments. We can set those up, and then we can also make sure that they're going.
I have a member that was not taking his medications. He's on seizure meds because he has a seizure disorder. They also act as mood stabilizers for him.
My name is Gordon, and I've been at Exodus for 2 years and almost a month. I have 2 types of seizures. I have a grand mal and I have petit mal. The grand mal, they say each time you go into a grand mal, it weakens your heart.
So we've got him on personal med pass, which means he comes down for his medicines 4 times a day.
Well, Jen, she helps me with my medication because I keep forgetting to take them because I ain't got a very good memory. If I forget my meds, she'll have somebody come and get me. Since I've been taking these medications, as far as I know, I haven't had a seizure. Well, without Jen, I'd be a nervous wreck. She takes the time and talks to me if I got a problem.
In getting to know him, I could see that he was in pain when he'd walk in the morning, and sometimes for the noon meds, but it was mostly the morning.
I mean, my back hurts every day, but some days they said they give me like 3 or 4 shots, and it'll last me like, without pain, for 3 to 6 months.
He said that there was a bunch of barriers for him, like he didn't know how to work the insurance to get an MRI for the pain clinic. He didn't know how to use his doctor and the whole referral system. Between Whitney and I, we were able to contact his doctor, get a referral to the pain clinic. So when he comes in the morning, that's our time. I'd put it on speaker and I teach him how to use the doctor's office and to ask for the nurse and, kind of guide him through that step so that if this ever happens to him again, he will know what to do. If I didn't intervene, I think he would have been in a lot of pain, possibly maybe self-medicate that pain with alcohol or drugs. It's a little too much for him sometimes where he just wants to give up. But I'm kind of there every morning saying, but wait, wait, we're getting this taken care of. There's a light at the end of the tunnel for you.
She's there when I need her.